We have a handout. Did everybody get a handout, or do we need more?
Do you need more Who did not get a handout? Okay, I'm gonna go make copies.
There's a couple in the back.
Oh, you have them back?
Okay.
Because I can make one.
And if anybody wants some slides or more information, they can email me. It's on the handout.
Who needs a handout? Raise your hand if you need a handout.
So anyway, we'll cover herbal medicine. We'll talk about a couple of common diseases or events and compare how the two different cultures would handle them. Then we move into more of the advances in medicine, starting with public health. I'll cover a world view of advances in medicine, and then Jim will kind of cover the local view of advances. So, and if you can't hear us, raise your hand, shout, do something. So I'll try as best I can.
Use your outside voice.
Okay, so today I'm going to be your barber surgeon. Yes, and Jim is going to be our shaman. So, when we were making this talk up, we looked into background information. What can we learn and find out? Well, when you're covering European medicine in the 18th century, there's a ton of information out there. Unfortunately, they didn't know what was going on with disease and medicine at the time, but there's a lot written about it. So I had plenty to work with. But, Jim.
Okay, this initial slide that Rob came up with is a good illustration of the difference between European medicine and medicine in this area. Obviously, one's a lot more complex than the other. Here we have basically a patient, a physician, and a problem. Pretty straightforward. Not so on the indigenous side. We have a healer, probably a shaman, but he's not alone. He's a powerful figure. And where does he derive his power? Well, there's... Sorry. Right there. So there's celestial bodies, there's wind and mountains, there's animals, there's phantasmagoric animals, there's fire and water. All these things in the Chumash view have power and have pertinence to medicine and to healing. So, as they say, it's complicated. Obviously, the topic of health and healing before, during, and after the mission period is a broad topic, and we're narrowing it down. I'm going to try to talk about the medicine that existed before the Spanish influence. So basically before 1769 in California. I'm going to try as much as possible to talk about local Chumash rather than the broader area of the Chumash people, and the Chumash people rather than California Indians in general. But this is difficult, and why is something I'm going to talk about. First of all, we'll go to the next slide. I decided a good label for the topic would be to borrow from Winston Churchill and call it a enigma wrapped in a mystery. And here's why. Why is it a mystery? First, as you know, the Chumash were a non-literate people, so they didn't tell us why they did what they did. We depend on people who reported on what they did. And here's Father Martinez's report in 1812. The Indians have no physicians, but they have quack healers who administer their remedies to the sick. Many of these remedies are fraudulent, but many are good. And then he talks about how they're not very willing to share what they do because it's proprietary interest. Well, if you believe that something that you're reporting on is fraudulent, you're probably not going to give a very objective report. In addition, if somebody is calling you a quack, you're probably not going to be real outgoing with the information that you're giving them. So that's the first problem that we see in understanding prehistoric Chumash medicine. If you were at the meeting last month, you might remember that Dr. Johnson said that this man is the source of 99%. I don't remember whether he said 90 or 99%, but that's irrelevant. The great majority of what we know about the Chumash is from this one man, John Peabody Harrison. I'm sorry, Harrington. He was from the Smithsonian Institute, and he didn't come with the same ecclesiastical problem that Father Martinez had in getting the history of the Chumash, but he started his interviews in 1910. So the people he was talking to were 4, 5, 6 generations removed from the area that we're trying to look at. Obviously, over those 140 years, Chumash medicine had been influenced by the Spanish and then by Yankee input. So we do have his reports. In fact, most of what we have is from his reports, but he was far removed temporarily. Another problem in understanding about a people's belief about medicine is sampling error. Who do you ask about what is the truth about medicine? If I asked you, what's the risk of GMO modified foods or alloys in dental fillings a danger? What about vaccination schedules? Would I get the same answer? No. And so it depends on who you ask what the belief about medicine was. By and large, Harrington asked these 8 individuals. These were his sources. These 3 are members of one family from the Santa Barbara area. Rosario Cooper was from San Luis Obispo. Let's see, this is, remind his name here, that's Fernando Librado is his favorite source of information. He was apparently a pretty good storyteller. He talked about Santa Rosa Island and the Ventura area and La Turisma area. He was such a good storyteller that John Peabody got him to sign an exclusive agreement that he wouldn't talk to other anthropologists. And then finally, what can we conclude about our little area if we get information from other areas as far as health and healing practices? Obviously, a tribe that lives near the ocean and estuary would have different plants to derive medicine from than somebody that lived in the pine forest. Kind of an amusing example of that is poison oak. The Yokuts over in the valley avoided it as far as possible, at all costs, understandably. But the Pomo Indians up north used the stems to weave baskets and the leaves to wrap food. The Chumash were somewhere in between. They avoided it generally, and they had cures for the rash. But they also took poison oak and stripped the leaves from the stem and used the drippings from that, what they called the tears of the poison oak, to staunch blood flow. So there's one simple plant that a wide variety in how it was used. So these are some of the elements of the mystery of Chumash medicine. What about the enigma? I think this is our biggest problem in understanding Chumash medicine. Our view of life, of the world, of the universe is so different than theirs that I think whenever we try to interpret it, we have a poor translation of what they believed. I noticed this myself as I was starting to read this because I kept making categories for what they did. You know, I would understand things like taking herbs or sweat baths and that sort of thing, but then other things these are supernatural. And then I said, no, you can't do that because I don't think the Chumash separated the world that way. The supernatural and what we live in today were not categories that they had. As has been said, for the Chumash, going to the cardiologist and going to church were not all that different. There was a continuity. So this is why I think it is difficult for us to really say that we understand Chumash medicine. The mystery is finding the facts, hidden by illiteracy, prejudice, or distance in time from those who recorded the facts, and also because of personal and regional variations. The enigma is understanding what those treatments, those acts, actually meant to the Chumash. What were they doing? What were they thinking? One of the things I tried to, what I realized is when you say, what were they thinking? You have to avoid going to, what were they thinking? Like I say to my 17-year-old grandson when he does another stupid thing, what were you thinking? He wasn't thinking. I mean, that's my point. But we can't do that when we go to the Chumash. They were thinking. They had a way to explain what they did, but penetrating that is difficult for us. To help illustrate this, let me tell you a story. This is extraordinary 41-year-old athlete, Lindsey Vonn, who decided, despite her age, she was going to try to qualify for the Olympics again. And she ignored the advice of her father, I believe, and her friends certainly, and took up skiing again, competitively. In brief, she skied in the qualifying races. She fell and tore her ACL in her knee 2 weeks before the Olympics, but she still went ahead with her plans, having qualified for the Olympics, and went ahead and skied. On her first run down the mountain, she caught her arm in a gate and had a devastating fracture of her leg. We would say these things might have been predictable, but they weren't. But they were accidents. Accidents that happened to her. Lindsay said it was because she was 5 inches off her ski line going down the mountain. But let's look at it like the Chumash might. Lindsay offended the spirits of her people and her village when she decided to compete despite their advice. Maybe the other skier who was competing with her in the preliminary trials and kept calling her grandmother put a curse on her. Maybe she forgot to give homage to the mountain before she skied down it. Or skiing at 80 miles an hour down the mountain, she might have offended the wind that she passed by. You laugh at that, you don't believe it, but then you explain to me why her dog died that week. Or, Lindsay, you explain to me why you were 5 inches off your ski line. The Chumash would be looking for those reasons. So, kind of putting it together, that this is, you might as well just go back there, just that incredible reconstruction of her leg, which is certainly 21st century medicine, but unrelated to the technical aspects of Chumash medicine. Okay, so putting this together, what is the understanding of, what can we say about the understanding that Chumash had of disease? First, don't try to separate the spiritual and the physical. Second, don't say that things happen for no reason. There has to be an explanation. And things happen for reasons that you're not expecting. In fact, maybe for reasons you have never even thought about. So I decided it's probably not a good rhetorical technique to begin my talk by saying, don't believe what I'm going to tell you. But I have to say that we are looking at something that's very strange to us in a world that's very strange to us. And probably our understanding it is very incomplete. Okay?
Well, let's move back to Europe side of things and talk a little bit about where we were in the 18th century in Europe as far as the understanding of disease. And it's fascinating to me that in the 18th century, they're still talking about people who wrote in the 5th century BCE. We have Empedocles, who wrote, he was a Greek philosopher, and he's the first one that came up with the concept of why we have disease, and it had to do with fire, air, water, and earth. These were the components in the body. And then he goes on to describe properties for each of these. We have fire that is hot and dry, and water which is wet and cold. Well, one of his contemporaries is Hippocrates. And Hippocrates went on to write in his book on the nature of man, the human body contains blood, phlegm, yellow and black bile. There are many things that make up its constitution and cause its pains and health. Health is primarily in which these constituent substances are in correct proportion to each other in strength and quantity and are well mixed. Pain occurs when one of the substances presents with a deficiency or an excess or is separated in the body and not mixed with others. Now, this is the basis of the humoral theory of medicine, which stayed till about the 18th century. One of the things that Hippocrates did that is different than the Chumash is he said, well, diseases are not caused by a supernatural power. They are just diseases, and they occur. So Galen comes along. Galen's a Roman in the 2nd century BCE. And Galen writes that blood is now the most important part of the humerals, and you can diagnose things through blood, and you can treat things through blood, which we'll see where that comes into play. He also connects the humors to your stage of life. So we have, manhood and old age and childhood, and then also the time of years. So, if it's autumn, then it's kind of a earth time or a black bile time, you might say. So, now Galen, the reason he's kind of famous is that his textbook on anatomy was used for over 1,000 years as the basis for human anatomy. Now, he describes things like the heart and the liver, but he didn't know what they did. He just looked at them and said, that's what we have. Now, the healers, who were they back in the 18th century? Well, in Europe, you had physicians. Now, physicians trained at universities, and they trained in the classics of Empedocles, Hippocrates, and Galen. And, they threw in some newer textbooks with it too. But Jim and I, we would have been surgeon barbers, because physicians didn't get their hands dirty. There was no surgery involved. They would just prescribe things for you. So Jim and I would have been surgeon barbers, and we would have had an apprenticeship, maybe of about 5 years, with another surgeon barber. Or we would have been in the military, where we would have learned battlefield techniques and amputations and such. Now, you all know the barber pole.
Yeah.
Does anybody know how that kind of got started? Yeah, well, I'll just so barber surgeons needed to advertise their skills. So after they would do a procedure on somebody, all the bandages were bloody, of course. So they would hang them outside on a pole, outside of their building. And as the wind whipped them, they would turn into a spiral. And that's where we get the barber pole from today.
Oh, that's a fun
Tell that the next time you're a barber.
I hope they didn't reduce the bandages.
All right, well, who were the Chumash healers? The easy answer for that is to say the shamans. But the shaman that is not a Chumash word. In fact, it's not a very well-defined word at all. It's used widely. What does it mean? I think the one implication that's pretty general when the term shaman is used is it's somebody who intervenes with the spirit world for the patient. For the Chumash, this meant things like giving herbs, but also naming children, or prescribing a cold bath, or trying to influence the weather. All of this was a unity in the shamans of the Chumash. How were they trained? Well, it was largely hereditary role, but not necessarily. If someone had unusual abilities, they would be appointed a shaman. And when they were appointed a shaman, they became part of this community on top. And I'm sure I'm not pronouncing these words in the way that the Chumash would. That's a glottal stop to start the word, so you start with before you talk. But anyway, however you pronounce it, they became part of this elite group, which included the village chief and his assistant, but all these other people who had roles in the village health. And because the health was a concern of everybody, not only of an individual, but of the village and of the community, all of them could be considered shamans. As far as their education, I presume that they learned from apprenticeship, although I did not see that specifically said anywhere. But before I say anything else, I want to go on a little bit of a tangent, because I think it's an interesting part of understanding the shamans. And that is that not only were the shamans the healers, but they could also be the killers. The shamans had extraordinary power, but it wasn't necessarily clear how they would use that power. The shaman may be coming to cure you when he came, but the shaman may also have talked to the village chief or to one of your adversaries and been influenced by him or her. So there was never a certainty about how the shaman was going to use their power. It could have been subverted by somebody who interfered, or perhaps the spirit that the shaman called up would have ill will toward you. An interesting parallel, I think, is the way that many of the herbs that the Chumash used could be dangerous or helpful. Certainly not all of them, but some of them were derived from very toxic plants. And the most important of this was the datura, or the Jimson weed, which is a very toxic plant. The castor bean is very toxic. So some of their medicines were derived from these dangerous plants. These are plants that could kill you, but what's more powerful than something that could kill you? That's the power that they wanted to get and extract from these plants. So in a way, some of their medicines were similar to the shamans in the sense that they were powerful, potent, and dangerous. Were there shaman specialists? Now I'm going to jump a little bit ahead in our sequence here, because the next section Rob's going to talk about healing methods. But in order to explain the shamans, I'm going to have to explain what they did, and which is sort of going to overlap onto that. And there's a whole lot on this. I'm not going to spend too much time, but let me quickly go through it. It's been said that there's a dizzying array of titles for these healers, and here's 4 of them. And if anybody wants to pronounce that for me, go ahead. I'm going to just call it Alalix. Alalix was a healer that used herbs and didn't use sorcery. The Spanish called them the good healers, and you can understand why that might be if they're not calling on spirits and forces that the Spanish didn't believe in. So this might be considered an herbalist. Whether they were part of that ANTAP or not is disagreed upon in things that I read. It seems to me they really wouldn't be part of the ANTAP if they didn't utilize all the power that was available. But at any rate, that was one type of healer. The next one, I should say that at least some of these we know could be men or women, and there was a suffix added to that word. That's not all, there'd be a suffix added indicating whether it was a man or a woman. The next one is the altipet, or whatever you would like to, however you'd like to pronounce that, the master of herbs and keeper of poisons. And that pertains to what I was talking about is the danger of some of the medicines that these people used. And just let me briefly tell you about one of them that was concocted over in the valley and came over this way, called Ayup. Ayup was made by old men who got alum from the Tule River and mixed it with pulverized rattlesnake and added some other things and came with little things about the size of the tip of your finger, and they called this ayup. And among the uses of this ayup was using it for body paint, using it for making women fertile, using it for winning games, for making someone sick by a touch of it to the skin, or sometimes an insect would be burned in the green ayup, and the ashes either touched to the person's skin or put in their food, and the insect would come back to life and devour the person. And black ayup was the most dangerous of all, because if it were put on an arrow, all you would have to do is shoot in the vicinity of an enemy, and he would be at least disabled and maybe killed. So that's one type of medicine that they had with this wide range of uses. And that was the responsibility of the El Tibet to manage that. The smoke doctor, or the alchak, would visit a sick person with a singer, accompanied by a singer and an associate, and he or she would blow smoke in the face and over the chest of the sick person while the singer sang healing songs and shook a rattle. They would repeat that, visiting the home 3 to 9 times, and then the patient either made it or didn't make it. Sometimes it was necessary for this for the smoking shaman to have a treatment, because they didn't smoke except for ritually. So after inhaling all this smoke, they'd have to go take some cure for the smoke itself. Another ritual of the alchak was to help recent widows who sometimes would have dreams of visions which were bad omens for them. And to prevent this, the smoke doctor would also blow smoke over their face. Another role for the smoke doctor was to be the village astronomer or astrologer, to interpret celestial events and decide whether this meant they should do something or avoid something. So this all fell under the role of the alchak. And the last one I'll talk about is the sucking doctor, the laxative. These shamans would scarify or scratch an offending area, an area that hurt or was inflamed, with a flint, and then they would suck that area. Sometimes they'd use a pipe, but apparently not always, and they would draw whatever was bad out of that area. One of the questions is, was this an equivalent of bloodletting, which was used in Europe? Probably not. Most of the time it doesn't seem like they drew that much blood out, and they treated the offending area rather than an area that would bleed a lot. So it probably wasn't the same idea as bloodletters. Occasionally the shaman would extract a pebble or a feather or something from that area that he sucked on, which the Spanish reporters said they had put in their mouth before they started the sucking. The sucking doctor said an enemy had put it in the patient's body, and now they will be okay. So that's a little bit of the spectrum of this, as I said, dizzying array, as it's called, of healing doctors and some of the things that they did.
A question?
Yes.
Were women involved in this at all, like the medicine women?
Yeah, it seems like the majority were men, but it's clear that for the smoking doctors and for the regular or curing herbalists, women were there. And women were part of the on top of the hierarchy. Predominantly men, but women were included. Yes.
Was there evidence that when, say one tribe found a particular herb that treated something, did they share that information between the tribes?
It seems like they did. For instance, this IF that I was talking about, this strange killing medicine that came over here. Yeah, maybe we ought to just let some of the questions at the end, but, yeah, okay, we'll try to keep moving, and then we're happy to answer questions.
Okay, well, let's move back to Europe briefly. And, you know, the European physicians, surgeon barbers, these were the common techniques that they would use to treat their patients. And, you know, bloodletting, we all kind of like, well, why would anybody do that? But, you know, if you're trying to balance the humors, it makes sense to bloodlet because maybe the disease is from an overabundance of blood in the body. Purging and cleansing is the same idea, you know, you've got yellow bile and you've got black bile and you're trying to balance them out. So by giving something to induce emesis, and you know, it could be a help to the body. Much like Jim was mentioning, blistering and counter irritation, you know, scarring the body and such, there was a reason for doing that, that they felt. The common cold was considered to be caused by blocked perspiration. So how would you treat that? Well, you would go into a sweat bath. You know, you'd go out in the sunlight and get real warm and try to sweat it out. So that was a common technique. Surgery in the 18th century was pretty much limited to superficial things. Like you got a splinter in you, maybe a abscess on your skin, you could lance that. Perhaps maybe minor amputations, a big toe or something like that that needed to come off because of an infection. Arsenic and lead were also prescribed treatments in Europe for various diseases. They knew that they did certain things to the body and they thought that that might be helpful to cure some of the problems. And herbal treatments, you all hopefully have the handout there. I'm not going to go into each and every herb that's there, but at least in the handout you can get an example of some of the common herbs. And it kind of, I tried to kind of relate how that is to today's medicine, as something like garlic has some antimicrobial properties and things. But the one I wanted to talk about mostly is laudanum, because it was unique to the Europeans. It was not here in San Luis Obispo. And, you know, for over 1,000 years, the Europeans knew that if you ground up or ate poppies from Turkey, opium poppies, that you had a kind of a narcotic effect. Well, come along the 17th century, there was an alchemist in Switzerland, and what he did is he took the opium poppy and crushed it up, and then poured brandy over it. Sounds like a dessert menu. But what he didn't know what he was doing with that, but what happened is morphine is in the opium poppy. And with the alcohol, it was dissolving into the brandy. And so at the end, he had brandy and morphine in his solution. Now, for a long time, everybody made it their own different way, but eventually the recipe got standardized. And so any physician could say, well, you're going to take 3 drops of laudanum and, be pretty certain it wasn't going to be a fatal dose for you.
Okay. This is a quote from the best book that I saw on Chumash medicine, for at least for us, the lay audience, and not academics. Among the Chumash illnesses treated using a combination of therapeutic methods intended to improve the patient's physical health, as well as to really establish harmony between the sick person and the supernatural world. Shamans performed rituals that provided for the patient's psychological needs and also administered herbal remedies and other practical treatments that alleviated the symptoms of illness. Now, I think that's a good summary, but it's a good summary from a Western viewpoint. Because again, and I respect these authors, and they certainly wrote frequently how uniform their world was in their mind. But you see what he's doing. He's sort of saying, well, there's therapeutic methods to help their physical health, and then there's another thing about establishing harmony with the supernatural world, and there's a psychological thing that they're treating, and then we're going to have a practical treatment. Well, I think automatically we do sort of interpret it that way. But again, I think that for the Chumash, there wasn't that, that kind of balance or delineation or separation. Okay, so what about herbal medicine? We know of 90 plants that the Chumash used, and we're going to start. Number one was, no.
Let's fast forward to 90.
Undoubtedly, this was the most important plant for the Chumash. And just so we understand, you'll see all these names if you do read history. This is the scientific name. It used to be Datura metaloides, but it's currently Datura rhytiel. And it's the kind found in this area. There has been another type introduced from Central America. It's mamoe in Chumash. This is should be an L. It's tolache in Spanish. And in the English-speaking world, it's Jimson weed. And it's called Jimson weed. Some of you may know this story, but the British sent troops down to Jamestown in 1669 to put down a rebellion. And those troops had a salad of Datura. And they started hallucinating, and they hallucinated for 11 days. Oh. And they had to be restrained because although they weren't violent, they were just doing things that they totally unpredictable. And so in English-speaking areas, in the colonies and subsequently in America, this plant has been commonly called Jimson weed. Other names for it are thorn apple, devil's trumpet, devil's snare, hell's bells, and farmers would call it local weed because it could affect cows if they grazed on it. All of this reflects both its beauty and the dangers of it. And it was most important in the Chumash people because it was encompassing both the individual's treatment and the community's treatment and the more inclusive total world view. All this was part of how the Chumash used Datura. For the individual, it could be used medicinally as a poultice. They didn't have the narcotics that the Europeans had, but it did put people into a trance, and so it could be used that way. To set a bone, they would give them some of this, and when the patient lost consciousness, they could set the bone. And if somebody had a serious illness and came close to death but recovered, they would give them Datura to purify the blood or refresh the spirit or restore the balance of their nature. Something that I don't understand, but they felt needed to be done if somebody had this desperate illness and came back to health again. As far as the community, at least among the local Chumash, it could be used repeatedly if somebody needed guidance for a big decision, if the village leaders needed to make a decision. They sometimes would take Datura and try to make contact with what they called their spirit guides to give them guidance in what they're to do. And one of the interesting roles for Datura was in the rite of passage for the Chumash. An adolescent boy or girl in this area, in some areas of the Chumash it was only the boys, but here, as I understand, it was both boys and girls, would be taken apart at early adolescence and instructed by a Datura giver and then administered Datura. And they would go into a trance for a day, for possibly 2 days. And the hope was that during the, I try not to say hallucinations, but my interpretation would be hallucinations that they experienced during this extended period. They would meet their spirit guide. And that would be it could be a peregrine falcon, it could be a bear, it could be a coyote. Whatever the spirit guide was would give them more power and give them guidance in what they should do in their life. So these are all areas where datura will be used. The chemical that causes the visions, the psychoactive component of the datura is the same as is in cocaine. And this plant had all kinds of associations. For instance, they felt that the datura was actually descended from the first people, some pre-human beings that separated from humankind at the Great Flood. It had to be harvested by old ladies, and the old ladies would pray to the plant before they took some of the root. If you had a vision after an experience with datura, you did not want to talk about it too much, because that might offend the spirit of the plant. And so it was invested with all these straightforward uses, like putting somebody to sleep before setting their bones, but also all the mystical things. And I think the plant has always been attractive to people. It blooms at night, so that kind of adds to its mystery. If you've seen Georgia O'Keeffe's drawings, it was a topic of many of her, it was the subject of many of her beautiful paintings because of it. So that's the one herb we're going to talk about. I've got others listed on the back of the handout that Rob prepared. Okay?
All right, well, let's cover a couple of common conditions where the healers would have gotten involved in. And first, I want to talk a little bit about childbirth. If we look at it from a European view, mostly the midwives attended the deliveries. And towards the end of the 1700s, physicians started to show up in the men, basically started to show up in the delivery room. A birthing chair was used commonly, but the more supine position became in the 18th or 19th century because physicians didn't like the birthing chair. The men didn't like the birthing chair, so they had the women lying flat. The cesarean section, obviously by its name, we know it's been around a long time, the Romans period. And in Roman lore, what we're told is that if a woman died in childbirth and the baby was unborn, that you couldn't bury them in one grave. You had to separate the child from the mother. So that's why a cesarean section was done. Now, they also probably found out that some of the children were alive when they did this. And so they knew that if a difficult labor happened and a woman died, it's possible the child could still live. Unfortunately, the mother rarely survived the procedure. And this was because of the blood problems. They didn't know how to control bleeding in surgery. Obviously, no anesthesia, which would be a shock to our bodies, and infection rates were so high. But we know, too, that the missionaries here at San Luis, when they trained in Mexico City, they were actually given some information about cesarean sections and how to perform the procedure. Because Father Gilly Tabata, who's buried there, was noted for doing cesarean sections in the area. So this was probably kind of a last-ditch effort to save the child. And unfortunately, even, I think about Adeline Dana, buried in our church, and Mom having, 21 kids or something like that. Well, realize that the mortality rate from a standard birth was 1 in 5 for the women. And she had 21, so she should have bought lottery tickets. So, Jim, do you have anything to add from the Chumash?
Well, there's not a lot there. There was a birthing hut, and they had midwives. The one thing that perhaps a little unique about the Chumash is that they were hunter-gatherers. So what do you do if you go into labor when you're on the road? Well, I can tell you. At least we have a report from Pedro Fages, who was part of the Portola expedition. And he said that when the Indian woman went into labor when she was away from home, she would dig a hole in the ground and line it with grass, and then he said heat it with fire, I presume put hot stones or something in there, and then, quote, would compose herself tranquilly to give birth. After she gave birth and she took care of the baby, the mother would, without delay, bathe herself in cold water, and then again, quote, whereupon the operation is completed without further ceremony. So it sounds fairly simple. That was how they did it. It's a bit reminiscent of Pearl Buck and The Good Earth, if you've read that story. You have your baby and you go back to work. I'm sure the mortality rate, however, was probably high, at least if not as high as in this Spanish.
So moving on to fractures here, just some basic information. We have both closed and open fractures. And a closed fracture is when you would break your bone, the bone would snap, but it would stay intact inside the body, the skin is intact. But an open fracture is when the bone actually protrudes from the skin or causes a break in the skin, thereby allowing bacteria into the fracture and creating a lot of problems. So closed fractures were treated probably very similar between the Chumash and the European barber surgeons, physicians. You would try to set the bone in place and you would put a splint around it of some type. The splinting material obviously would differ probably between the cultures. One problem, they didn't have x-ray machines. So you've got a fracture and you're trying to figure out just, maybe it's this way. Well, but a lot of them probably still ended up not in a good position. So your arm may have been curved, or perhaps a leg never healed because they never got the bones close enough together to heal. So a lot of disability even with closed fractures. Open fractures, on the other hand, if you were at the Chumash village and had an open fracture, it was fatal. You were not going to survive. The infection that pursued afterwards was just too much. So it was 100% fatality, essentially. In Europe, we had some steel and metal parts, so they knew that it was better to just amputate the extremity that was fractured in those situations. So they would go ahead and remove the leg or the arm, and even with that, though, there was still about a 40% mortality rate from the amputation because you're dealing with bleeding and infection problems after the procedure. All right, well, let's move on to public health a little bit, because at least from the European perspective, improvements in public health were huge. We're starting at the beginning of the 1700s. London was about 750,000 people, and there was terrible air pollution. They didn't know that sewage should be kept away from drinking water. And food processing, people were eating spoiled foods, contaminated foods. It's a bad situation. The first real kind of thing that happens, though, in the 1700s is a fellow Scottish surgeon by the name of James Lynn. He was on board the Royal Navy ships traveling around the world, and he got a lot of experience with seeing people with scurvy. And he started asking questions of himself. It says, well, it seems to be dietary related. So Lynn comes up with the first controlled study in medicine. And in our training, we always learn about randomized placebo-controlled double-blind studies. Well, this was the first controlled study that was described. And he took a group of sailors and broke them out into 6 different groups, and he tried 6 different treatments for scurvy. He gave one group cider, he gave one group sulfuric acid, one group vinegar, another group seawater, another group barley wine, and another group oranges and limes. And obviously the orange and lime group did a lot better than the rest of the groups. So it took probably over 30 years for the Royal Navy to believe it before they started to push limes and fruits for their sailors.
That's why they called sailors limeys.
That's right. So the other big development in the 18th century is the smallpox vaccine. Smallpox is rampant at this time, and an English surgeon by the name of, or English physician, not a surgeon who did this one, Edward Jenner, he realized that milkmaids did not seem to get smallpox. And he started to look into that. Well, milkmaids frequently got what is called cowpox, which looked kind of similar to smallpox, but it certainly wasn't nearly as deadly a disease. And so he gets the idea that maybe if we take a little pox from one of the milkmaids and we take some material out of it and we give it to you, that maybe that'll help you with your smallpox.
No thanks.
Well, guess what? It worked. By doing that, he was able to take the mortality of smallpox from about 30% to 3%. So it was quite an improvement. Well, the story gets better with smallpox. So King Carlos IV, now in Spain, we're in the early 1802, 1803 period. He loses his daughter to smallpox. And he says, well, I'm going to fund a program to eradicate smallpox in the Spanish territories. So he goes to Dr. Francisco Javier de Balmas and says, you need to figure out a way to get cowpox from Spain to the New World. And so they didn't have incubators and all sorts of fancy things that we have today to keep things going. So he comes up with kind of a novel but unusual way of doing it. He gets a group of orphan boys. And before they set off to sail, he takes a few of them and inoculates them with cowpox. They get out to sea, they get the little boil on their arm, they scrape it and give it to the next boys. And then a week or two later, the next boys get it. And by the time you're in the New World, boys are developing the cowpox. So they could pass it along to the missionaries, to the soldiers, to whomever they needed to give it to. And we know, and in this map it's probably really hard to see, but they actually brought it to San Diego and San Francisco. So we know that it did pass through here in the early 1800s. And we have seen some records that it was given to the Indians that worked at the missions too. So that was quite an experiment.
You must have stopped at 25 or 30. Okay. I'll just briefly talk about contaminants in the Chumash, and this is anybody who's been to the beach in Santa Barbara and sometimes here knows about tar balls, that stuff that gets on your feet and is so annoying. It's due to underwater seeps that have been there as far as we know forever. And the Chumash used this substance, although not the stuff at the beach, but the land, the dried, hardened part on the land, most of which came from Price Canyon, as a matter of fact, and used it as a caulk, as a glue, as paint, as waterproofing material. But the problem is that tar has polycyclic aromatic hydrocarbons, which we know causes health problems, causes disease. It causes cancer, it causes liver failure, it causes birth defects. And it's interesting conjecture, and people have looked at this to see if their exposure to asphalt was a health risk to the Chumash. And it's hard to document that because these illnesses that it causes don't show up in the skeleton, which is basically what we have to go with. But there is some evidence that it did cause health problems. And this slide just shows some of the ways they used it. If they wanted to waterproof a basket to make it a water carrier, they would put this melted asphalt in the basket with some pebbles, and then they would shake it until that was equally distributed and the basket became waterproof, obviously then their water would be contaminated from this stuff that was from the inside of the basket. In the same way, if they used shells for scooping food, this is a abalone shell where they plug the holes with asphalt. Their canoes, they combined the asphalt with pine tar and sealed the wood. This is the stone from a hopper basket, which the basket would be attached to the stone by asphalt. So they had a number of ways they were exposed to asphalt, and if that wasn't enough, they sometimes chewed it and applied it to the skin as a medication. So we think that probably that could have been had an effect on their health. As the population increased in this area, the evidence is that they ate more shellfish, which also would be a more concentrated source of these polycyclic hydrocarbons. So that's just one area. We think of contaminants as a modern problem, but it existed before. The cinnabar that was used in the mission here for the floor and up the walls contains mercury, and that would have been another contaminant that they faced.
We're pretty getting close to the end, right?
About 5 minutes.
Okay, well then I'll just go real fast through European medicine advances. Big one, anesthesia, 1846, where they started using ether. Semmelweis determines that he can really cut down the infection rate in obstetrics by washing hands and instruments. Pasteur sees microorganisms in fermenting foods. Lister uses carbolic acid to treat open fractures without amputation. Wilhelm Röntgen, playing with vacuum tubes, takes a picture of his wife's hand and sees it on a photographic plate, the bones. Insulin was discovered by grinding up dog pancreases and injecting it. Fleming here, he found out that when he came back from vacation one day, that he wasn't growing out his bacteria, and he started to figure out that mold in the top of the petri dish was causing that. Heart-lung bypass, a huge advantage in the DNA structure. If anybody has not read the Double Helix, I would recommend that. It's a great historical book. The polio vaccine, its main contribution besides treating polio was that everybody knew somebody with polio. You had FDR, you had all sorts of people. And all of a sudden this vaccine stops it. Well, everybody's now rolling up their sleeve for a vaccine. Public health really took off with that. Organ transplants and the mRNA vaccine, which is what gave us the COVID vaccine, and I think that's going to show promise in cancer treatment in the future. So Jim, you want to go quickly through the slow?
Okay, just quickly, probably the first physician in California was the Pedro Prat, who was part of the Court of Law expedition. We don't know much about Fort, at least I don't, unless you do. Okay.
Other than the county hired him.
Yeah, the county hired him. The first European physician here was Dr. Hayes, who came in 1866 and was a Union Army physician whose wife was not sympathetic to the Union cause, and so he asked to be transferred to San Francisco and came down from San Francisco to here in 1866. When he came here, his competition was probably Indian healers, European healers. Louis was dispensing Chinese herbs and medicines from his store, and it turned out that the new pastor and his wife at the Episcopalian Church were also recommending herbs. Dr. Hayes did not like alternative medicine. In fact, Dan Krieger wrote that he became angry when he heard about it, and he apparently succeeded in getting the pastor dismissed from his role at the Episcopal Church. Let's see. This is his house. You probably see it just beside the history, just out from the History Museum. Let's look at a couple other things here. This is the site of a sanitarium on Marsh Street. It has been converted into office buildings, but it's still there. It was later called the San Luis Sanitarium, and it was purchased by in time by Dr. French, which in turn became French Hospital. This is Dr. Bradbury's house. He built it in 1912. This is the dining room table. Well, we'll look at this. Okay, just wait a minute. This is the dining room table where he did his surgery. The lady who lives there now said they took down the wall between the kitchen and this, and you can see the sliding doors here that would close off the operating room. Next door to the house is, oh wait just a minute too. Next door to the house is this, which became a sanitarium, and the front door, interestingly, is back here, so Dr. Bradbury could walk out his back door and into the sanitarium. She tells me that this upstairs is still divided into, I forget exactly how many, 6 or 8 small rooms that presumably were rooms for patients back when it was a sanitarium. So that's his house, that's his sanitarium, and across the street is this structure, which is a home for unwed mothers. They would live here during their pregnancy, deliver here, and stay there until they were ready to go back into society. And apparently Dr. Bradbury attended the mothers there as well.
Where is that in town?
Yeah, that's on Bouchon Street.
And that one is Bouchon as well?
They both are.
Oh, okay.
Yeah, all three
All
are.
three, okay.
This is San Luis High School, and as we go along Santa Rosa here, we have what's left of the mountain view. This is where the Mountain View Sanitarium was. This in turn became Sierra Vista Hospital. So that's another site that.
I was born in Mountain View Hospital.
I guess at that point, I would say we're up to date. Huh?
So thanks.
Wow.